professor in mental health nursing. So, if you take a psychiatric setup or a psychiatric hospital, we come across different types of conditions of clients with different disorders. So, some of those clients will be able to control their emotions or to manage their emotions. There are some clients wherein they become very aggressive, their thought is such that it's completely the negative thought, the self-destructive thought, or you can say them as an aggressive kind of a personality or a violent person. So such persons or such clients will be treated with the psychopharmacological agents, and apart from those medications that the client uses, you will be also indicated for some psychotherapies. One of those therapies which the client will be indicated to modify or change his thought or thinking pattern as well as his behavior is the cognitive behavior therapy. So today I'm going to talk about the cognitive behavior therapy, which is CBT. Right. So mainly this cognitive behavior therapy, as the name says, it's a combination of cognitive therapy as well as the behavior therapy. As you know very well that what we think or what our thoughts are will be exhibited or expressed out in terms of our behavior. Right. So you can say that our thoughts are, interrelated or connected with the behavior what we show. So there is a connection between the thought and the behavior. So we need to modify the behavior. That means we need to modify the thinking process or the thought. So the client will be indicated for the cognitive behavior therapy, which is the combination of both the cognitive therapy and the behavior therapy. Let us see the definition of cognitive behavior therapy. Cognitive behavior therapy is a type of psychotherapeutic technique or treatment that helps the patients learn how to identify and change destructive or disturbing thought patterns that have a negative influence on the behavior as well as emotions of a person. So, it is a form of a treatment that we use to make the patient to identify what are those negative thoughts which the client is having and to bring about the modification in the thoughts as well as the behavior. Another definition we have, cognitive behavior therapy focuses on changing the automatic negative thoughts that can contribute to and worsen emotional difficulties, depression, and anxiety. These spontaneous thoughts have detrimental effect on the mood of the person. We can say that it can have an influence on the mood. So we say cognitive behavior therapy as a treatment process which is used to bring about the change in the thoughts of the person, the distorted thoughts to be modified, and as well as the behavior modifications which can be done so that the mood of the patients is managed. So if you take the overall cognitive behavior therapy, it is a structured form of the psychotherapy. That means it has got a particular technique, it has got a particular way of conducting a behavior therapy. So it is a structured form of a psychotherapy, and it is time limited. It's got a particular duration or some number of sessions that the client can undergo, a maximum of 5 to 20 sessions. It is a problem focused or goal oriented therapy. So we have got a problem here that there is a distorted thought. So we need to change this problem or find a solution for it. And it is also goal oriented, that we have to bring about a change in the mood or behavior of a person. So we can say it is having a goal of problem solving as well as a goal to bring about change in the behavior. So it has got a variety of strategies and skills or the techniques that it uses to bring about a change, and also it is having a shared therapeutic responsibility or activity. So we have got the therapist as well as the client who are working together, who participate together in this particular activity, who have got their own responsibilities to bring about a modification or a betterment in the client. Moving on to the cognitive behavior therapy model. So if you take the model, you can say that it is a cyclic model. Okay, so how the thoughts or the cognition is interconnected with the behavior of a person and also feelings and emotions of the person. You understand, when a person is behaving in this a maladaptive way, in a aggressive way, for example, you understand that his thought is distorted, right? His thought is disturbed, which is shown in the form of behavior. Why a particular behavior is shown is the behavior exhibited can be the expression of his mood or expression of his feelings and emotions. So you understand that the thoughts, the behavior, as well as feelings and emotions are interrelated. And to bring about a change in the person, we need to first modify the thought of a person, then the feelings or the behavior of a person can be modified. So this is the model of cognitive behavior therapy. Moving on to the goals of CBT. Number one, it is going to help the patient to develop the skills and strategies for becoming and staying healthy. So overall, CBT is having a goal of some strategies or skills which will be taught to the person to lead a healthy life. CBT focuses on here and now, on the problems of daily life. So whatever the problems that an individual faces, on a daily basis, CBT focuses on these kind of problems to bring about a change in the person to cope up in a better way. The next goal is CBT is going to help the person to have a self-examination, to make the person understand or perceive how he is feeling and how these feelings are going to affect him. So that is what it is going to focus on the self-examination, which helps the individual to identify his feelings and to bring about change in these feelings. Moving on to the types of the cognitive behavior therapy. CBT has got many approaches as well as the techniques to bring about a change in the thought, emotions, as well as behavior of a person. So if you take the types of the cognitive behavior therapy, it can range from structured psychotherapy to self-help materials which will bring about modification in the person. So let us see the types of the CBT. The first one is the cognitive therapy. Very, very important. The cognitive therapy. It will center on the identification and changing of distorted thoughts, inaccurate thinking patterns, emotional responses, as well as behavior. So here in the cognitive therapy, the therapist is going to help the client to identify what are the thinking process. Okay, what are the distorted thinking process? How these thinking process or the pattern is going to have an effect on these emotions as well as behavior. So that is what is done in the cognitive therapy. So the next type is dialectical behavior therapy. So dialectical behavior therapy is going to address on the cognition as well as the behavior of the person while incorporating strategies such as emotional regulation and mindfulness. So the dialectical behavior therapy is the one which is used wherein the client will be able to recognize his feelings or emotions and how these are going to have an effect on the behavior of a person, wherein the behavior is being controlled by the thoughts. So that is what is the dialectical behavior therapy. Moving on to the next type, which is the multimodal therapy. What is this multimodal therapy? The multimodal therapy is the one which is going to use the various strategies for addressing the client's problems. So in this, as the name says, multimodal, we have got mainly the 7 different modes which are used to bring about a change in the behavior. Behavior, affect, sensation, imagery, cognition, interpersonal factors, and drug or biological consideration. So all these areas will be taken care of when we use the multimodal type of the behavioral therapy. The next type is the rational emotive behavior therapy. This type of a therapy, it focuses on identifying the irrational beliefs of a person and actively challenge these irrational beliefs and finally learn to recognize and bring about a change on these beliefs, right? So that is called as rational emotive behavior therapy. You're going to bring about you're going to realize the rationale for these particular behavior, right? So we are going to bring about a change on this irrational behavior by making it rational. So these are the various types of cognitive behavior therapy that we use. The combination of all these therapies that we use. Moving on to the cognitive behavior therapy techniques. So we have got number of techniques or the approaches of doing this cognitive behavior therapy. Number one technique is identifying the negative thoughts or the negative feelings. It is very important to understand and to know how these negative thoughts, emotions, or feelings are, causing a maladaptive behavior in a person. So it is a very difficult process for a person to do an introspection, but the self-examination or the introspection is actually going to help out the person to identify what exactly is this distorted or a negative thought is and how it is contributing to a maladaptive behavior. So that is first one, identifying the negative thoughts. The second technique that we have is practicing new skills. So it is very important to start practicing the new skills, and slowly we can inculcate this new skill which is learned for the reality in the real life situations, right? So learning a new skill is again a difficult task, but it takes a lot of time to practice this new skill. So once these new skills are learned, the individual can put these new skills in the real life situations. So say for example, there is a person with substance use disorder. He will be taught how to practice a new skills to come out of this trigger of the relapse. Okay, so there are various situations which the person will be triggered to use these substances again when he gets discharged. So he has to make lot of deals to avoid and to control himself, and even the social setting wherein he will be put in, which can force him to get into the substance abuse again. So he will be given the new ways or the practical new skills that the client will learn to actually face the real life situations by doing many rehearsals. Okay, so by doing that, the new skills that he will be learning. Say for example, again, so such a client with substance use disorder will be put in various scenarios wherein he will witness the different role plays or psychodrama, wherein it will be a story of his own life. Okay, it will be depicted in the form of a psychodrama, just to bring the experience for the client to realize how he can deal with such kind of a similar situation in future when he comes across, wherein he can avoid the relapse, right? So that kind of a new experience that you're going to teach the client in this technique of practicing the new skill. The next technique is the goal setting. So during the CBT, the therapist can assist and help the client to set the various types of the goals. It can be a long-term goal or a short-term goal. The therapist will assist the client to identify the various goal setting methods specifically related to the SMART technique, right? So what is this SMART? It is the goals which can be set in terms of specificity, the measurable goal, the goals which can be attained, the goals which can be relevant, and time-based goals. So based on this SMART setup, the goals will be set for the clients, or the therapist will help the client during the CBT process to set the various goals. The next technique is the problem solving technique. So learning a problem solving skill again will be taught in the CBT technique wherein the client will be able to identify what exactly the problem is and what kind of a solution can be brought about to solve this particular problem. So that can arise in day to day life. It can be various stressors, small or big, whatever it is, the client will be able to identify the problem and also solve the problem, which is going to in turn reduce the psychological and physical illness. If you take the problem solving technique in the CBT, we have got certain steps. Okay, mainly the 5 steps. The first one is the identification of the problem. So here in this step, the client will be assisted by the therapist to identify what exactly his concern is or the problem is. The next step is generating the list of problem solutions. So for this particular problem which is identified, what are the various solutions that can be brought about? So the list of the solution can be generated or can be developed. That is the second step. The third step is evaluating the strength and weakness of the solution which is generated. So each of the solution has got its own strengths and weakness. You're going to evaluate what is the strength and the weakness of the particular problem solving technique or the solution. So once the strength and weaknesses you identify, then you're going to actually select the exact problem solution. Then you're actually going to choose the solution for the problem. So you will be clear enough to choose the exact solution for the problem. Once the solution is chosen, the last step is to implement the solution, right? So these are the various steps that are used in CBT as a problem solving technique. The next technique is the self-monitoring. So self-monitoring is otherwise called as journalizing, or you can call it as a diary work. So it is nothing but keeping a track on the particular behavior. So the client will be given the homework to maintain a diary or a journal about his behavior, right? The symptoms or experiences over the time of the therapy, and also share these experiences or concerns with the therapist. So that is why the client is given an homework to maintain the diary, to keep a track on his behavior and various experiences. So when he comes to meet the therapist, he can just address these concerns with address these concerns with the therapist. So this self-monitoring is going to help out the therapist to plan the best possible treatment for the client. Say for example, there is a client with an eating disorder, right? So the therapist asks the client to maintain a self-monitoring or a diary work. So he will maintain a diary about his particular behavior. So how frequently he did this, eating behavior. So what was the situation which triggered him for this particular behavior to be, exhibited. So what were the thoughts and feelings that went along when he was consuming this particular meal or snack? So all these things will be entered or monitored in the report or in the diary, wherein this concerns he will get to the therapist once he meets the therapist and the problems can be solved. So that is the purpose of self-monitoring. So this is about the various techniques of the cognitive behavior. Moving on to when CBT is used. In which all conditions or situations the cognitive behavior therapy can be used. Number one, to manage the symptoms of mental illness. It can be any kind of a mental illness wherein the person is having distorted thought in his emotions and his behavior. So any kind of the symptoms a person experiences which indicates that he is having a mental illness, this can be used. Next thing is to prevent the relapse of the mental illness. Okay, this to prevent the relapse of the symptoms of mental illness. So in those situations or conditions it is used. The next thing is to treat the mental illness when we find out that the medication therapy or the psychopharmacological therapy is not effective in the treatment, right? It's not necessary that always there should be a combination of psychotherapy with the medications. There are some times or situations wherein the psychopharmacological agents are not helping out the patient, right? So in those conditions, they can opt only the CBT or only the psychotherapy. CBT is used when the client wants to learn the coping skills to manage with the stressors and also to identify and manage the various emotions. It is used to resolve the relationship problems whenever there is a lot of interpersonal relationship problems. So it is used to identify those problems and to learn the better ways to communicate and to solve the interpersonal problems or the conflicts. So next is it is used in the areas of grief or loss. So whenever the person is experiencing any kind of a situation of grief or loss, in those situations CBT is used. It is used to overcome the emotional trauma which happens because of any kind of the abuses or violence. It is also used to cope up with the medical illness. So even in the medical disorders, we have got some conditions wherein the CBT can be used for a treatment and also to manage the chronic physical symptoms. So these are the situations where CBT can be used. Moving on to the indication, exactly we can understand in which psychiatric disorders the cognitive behavior therapy can be used. Number one, in case of sleep disorders, okay, it can be insomnia. The sexual disorders, it's indicated in depression, bipolar disorders, anxiety disorders, phobias, obsessive compulsive disorders, eating disorders, substance use disorders, schizophrenia, and PTSD, post-traumatic stress disorders. CBT is also found to be helpful to cope up with chronic pain or serious illnesses, any kind of divorce or breakups, grief or loss, the person with a low self-esteem, relationship problems, as well as for the stress management. So these are the indications of the CBT. Moving on to the procedure of CBT. So how is the procedure done? The first session is nothing but the client as well as the therapist, they meet up. Okay. So what are those things which is done in the first step? You need to find out whether it is his or her approach. So whether it is the approach which is comes from the client, okay, so which is going to give an idea to the therapist that he is self-motivated to bring about a change in himself, right? So you want to find out what kind of approach is it, whether the approach is from the client himself or herself. The next thing which you're going to find out is what type of a therapy is going to be useful for the client. So in the CBT, you've got various types of the therapy again. So you're going to determine what type of a therapy is suitable for the client's problem. The next is you're going to set up a goal for the treatment. It can be a short-term goal or a long-term goal. You're going to find out or you're going to set up a goal and prioritize the goal. Then you're going to plan the length of each session. So what should be the length of each session, the overall duration of the session, and you're going to also determine how many sessions that the client may require. He may require 5 sessions or 10 sessions or 20 sessions. So you are going to plan accordingly based on the condition of the client what should be the number of the sessions. So that is the preliminary things that you are going to do in the procedure. Moving on to the steps. Number one is identify troubling situations or conditions in the particular life of the person. So these includes to identify what are the concerns or problems or issues from the client's end. It can be related to the grief or loss. It can be related to the physical problems or medical problems, anger or any kind of a symptoms of mental illness. So that is what you're going to identify what is the actual problem of the client. So here in this particular step, the client as well as the therapist, they sit together, they participate together to identify what are the problems and what goals can be set for this particular problem to be solved. So that is what is the first step. The second step is become aware of the thoughts, emotions and beliefs about these particular problems. You're going to help the client to gain the awareness or gain the insights about all these problems in terms of the thoughts, behavior as well as the emotions. So how you're going to make the client to become aware? So first thing, you're going to make the client to have a self-talk. So he has to talk to himself. He has to find out what is the reason for this particular behavior that he has shown. What is the reason that these particular feelings are happening to him, right? He has to do a self-discovery or the self-talk. He has to do the self-analysis. The next thing is you're going to make the client to understand the meaning behind a particular situation or the problem. First thing, you're going to make the client to do the self-talk. Second thing, you're going to make the client to understand the meaning behind the particular situation, why it happened. The third thing is you're going to make the client to understand the beliefs about himself as the others as well as the events which happen. So all these things which is going to help the client to become aware or to gain the insight over his particular problem, thought, feelings as well as his emotions. The third step is identifying the negative and inappropriate or inaccurate thinking. So here the therapist may ask the client to pay attention to his physical, emotional and behavioral responses in different situations. So here the client is to do the work is to pay attention to various types or various forms of the behavior that he exhibits or thoughts that he has or feelings that he has, right? So that is what is identifying the negative thoughts. The next step is to reshape the negative or inaccurate thinking. So what is done here? Here, the therapist will assist the client to reshape his long-standing ways about thinking about himself as well as others. So here, the overall problem solution is being found to reshape his behavior or to reshape his cognition. So that is about the various steps or the procedure of cognitive behavior therapy. Moving on to the length of the therapy. CBT is generally considered as a short-term therapy. Usually the total sessions, if you take, it will be around 10 to 20 sessions which the client may require depending upon the condition or the severity or symptoms of the client. Moving on to the factors which can influence the CBT. There are some factors which you have to keep in mind when you plan for a CBT. What are those? Number one is the type of the disorder or the situation. What type of a disorder the client is experiencing or what type of a situation the client is experiencing, that you're going to determine, which is going to have an effect on the therapy sessions which you're going to give. The next is severity of the symptom. How severe is the symptom the client is experiencing? How long the client had this particular problem, since how long that he is dealing with this particular problem. Next is how quickly that the client can make the progress, or how is his ability to bring about change in himself, the self-motivation or the ability to make the progress in the therapy. So that you're going to determine. Next, how much stress is the client experiencing? How much is the support that he receives from his support group? It can be the family, friends, or how much support that he is getting to cope up with the different situation or problematic situations. So all these are the factors that has to be considered when you plan for a CBT. Moving on to the personals or the team of CBT, who are the ones who are going to provide the CBT. We have got the counselors, psychologists, the therapists. We have got the small groups wherein the client may become one of the members of the group, or we have an online group. So these are the team of the cognitive behavior therapy. Moving on to the benefits of the CBT. What are the benefits? Number one, it helps the client to engage in healthier thinking patterns or healthier thinking by becoming aware of his negative thoughts, which is going to dampen his feelings and moods, right? So you're going to bring about overall health in the person by making him to identify what are those negative thoughts, which is going to have an impact on their mood. The second benefit is, since it is a short-term treatment session, it is very much effective for the client. You can actually see the changes in the client once the therapy session begins. By the end of the therapy sessions, you can see that a lot of changes that he has brought about in his thinking process. It has been found that it is very much useful for a variety of maladaptive behavior. It is found to be more affordable compared to other types of the therapists. And also it is found to be very much effective. It can be a one-to-one face-to-face therapy, or it can be a online therapy sessions. It is found to be effective even for a online sessions. It can be used even for the clients who don't require any kind of a psychotropic medication. So without the medications also, this therapy is found to be effective. So these are the benefits of the cognitive behavior therapy, or we can say the advantages. Moving on to the risks associated with the cognitive behavior therapy, we can say some limitations, or we can say it as a disadvantages. Number one, it can explore the painful feelings. So there are situations wherein we can bring back the memory of those painful events which happened in the life of the person, which he had stored in the unconscious level. So all those things can be brought to the conscious level. So when such things are brought to the conscious level, it can even disrupt the personality, or it can affect the life of the person. So what that is one of the drawbacks of this particular cognitive behavior therapy, wherein the painful experiences can be brought to the conscious life of the person. Next is the patient can feel emotionally uncomfortable, right? So when is undergoing this process of cognitive behavior therapy, there are times that he may feel very uncomfortable or shameful about his own thoughts or his own negative feelings and behaviors. So it may bring about some uncomfortable feeling for the client. So at times what happens during the CBT, there may be chances that his expressions can be expressed out in terms of crying spells, or in terms of feeling the anger or getting very upset. So all these feelings can be brought about, expressed when he is undergoing a cognitive behavior therapy. So in spite of all these expression of feelings or behavior, when the client is working with the therapist will be there available for the client to cope up with these situations or feelings, and he will be there to motivate and encourage the client to undergo the therapy sessions, which is going to make the client feel beneficial. So this is about the cognitive behavior therapy. The main thing here is you're going to bring about a modification in the thinking, which is going to have an effect on the behavior as well as feelings and emotions of the client. Hope you all have understood the topic.